Hey everybody, how are you? This is Dr. Deneen Carr. I am here today to answer a question that was presented on the Dr. Deneen Carr Facebook page. The question was submitted by Kimberly, and she wanted to know, how did you find out that you had breast cancer? Well, just full disclosure here, y'all. Kimberly knows me very well, and she knows that I always have the craziest stories and craziest life antics and things that happen to me. I don't know. I just attract all kind of odd energy. So this story is no different, Kim and everyone else. Here's the answer. So when I went to the hospital on the day before my birthday, I had to have a follow-up mammogram and ultrasound done. For those of you who are not familiar with what those two procedures are, those are procedures whereby the radiologist gets x-rays and images to make an assessment of whether or not you have cancer in your breast. And those additional images are ordered after your yearly mammogram is completed. If your yearly mammogram is okay and they say you're all clear, nothing's going on, see you next year, you're out of here. Well, for some people like myself who had a history of dense breast tissue and fibrocystic breast, they tend to order up some extra stuff to make sure they're taking good care of us. So I was there on the day before my birthday for the additional images. Well, when I was getting my mammogram done, I noticed something about the tech. When she was x-raying my right breast, which was not affected with anything, she was cool, she was professional, and she was calm. When she got to my left breast and started doing the images, I noticed a change in her body language. She became nervous. She became fidgety. And I'm looking like, okay, I'm trying to keep my composure and not get rattled by anything. And then she says, after she takes a few more images, she says, I need to talk to the radiologist because I want to see if I have to take any more x-rays. Sure, fine. I'll be right here, sitting right here waiting. As soon as she walked out of that room, I went over to that computer because I'm a dentist, right? And I know how to read x-rays, right? I went over to that computer. I took a look, and I should have stayed in a patient's place because what I saw was the biggest tumor I'd ever seen in my life. I knew. And then confirmation of what I knew came about 40 minutes later after the ultrasound when the radiologist and the tech sat me down in a room and told me, you need to follow up with the breast surgeon. And I'm like, why would I need to follow up with a breast surgeon? Do I have breast cancer? Because I'm just trying to pull it out of them. And the radiologist was like, well, I can't answer that, but the surgeon who does operations on people with cancer, she can. So Kimberly, that's how I found out. Very odd, very non-traditional way. But I will tell you this, it is so much better to know than to not know. Go get your yearly mammograms. If you do have cancer, it's not the end of the world. I'm still here. It's not the end of the world. If it's caught early, it can be treated easily. If it's caught later, it can still be treated and you can go on with the rest of your life. So I hope that answers your question. I want everybody to be encouraged, to be happy today, and I will get back with you soon. Have a great day and thank you for listening.